Everyone has an opinion about plastic surgery, but behind every procedure is a story, a reason, a choice. Today I'm sitting down with a group of people to explore the deeper why behind it all. People would rather pay for a body than earn it. Okay.
Thank you. Oh, great.
Okay, so we have someone who switched. Who wants to go first with their reason?
First?
Sure.
I think that people would rather pay for their bodies than earn it because it's harder work. It's more discipline that you have to do, and it's a quicker fix to just go and fix whatever it is that you want instead of taking the time to do whatever it is that you're trying to do.
I think like baseline though, if you're like, would you rather do this or that? I think everybody would rather have a natural physique that they worked hard for, and they can tell people like, yeah, I worked for this, yeah, I ran for this, yeah, I did everything for this. But a lot of people, it's not a would you rather situation, it's a I'm too lazy to do that, or not even that, or like I have had trouble doing that, or I feel like that's not achievable for me, I guess.
I've always felt taking a natural approach to things in life, whether it's through your eating, your dieting, or through your skincare or anything else, is more honorable. And I respect the work aspect that it takes to do. And I feel like in the long run that it's a healthy way to live your life like that too. Because later on in life, you know, sometimes plastic surgery can leave like nasty scars and everything. I just come from the old school, you know, way of thinking. So that's kind of like my opinion on it. I believe in the natural methods. That's kind of like where I stand.
Yeah, but do you think people would pay for a body or earn it?
I think people would pay for it. People that want the easy way out, that don't want to work and earn it. But like you said too, when you do something for yourself, you know that you did this. I know that everything, the way I look and everything that I've achieved, I've done it alone. I've done it with no help, and I've done it with nothing, no surgeries of any kind, no plastic surgery or nothing. Everything I achieved is on my own.
Well, and I would throw in that I think there's a lot of shame in our culture attached to paying for physical modifications.
Yeah.
If we look at GLP-1s, the shame that society is attached to using those. So I think when it comes to surgery, the same rule would apply, that people, thinking broadly, either don't have the money to pay for it, or they look at how they may be judged for paying for it versus doing the work.
That's a good one.
It's also why a lot of people will lie about work that they had.
Yes, that's true.
Yes, they won't be honest about it. They'll conceal it.
I think doing both things is great. I think I look at something like Ozempic and I think of the incredible changes that it's done for people and the incredible improvements that it's done for people's lives. I think when you combine the amazing advances that have been made, especially now, you know, in 2025, what we have, taking advantage of that plus doing those old school things, for lack of a better word, I think it makes for an incredible change in people. People should take advantage of everything that's at their disposal.
I agree. And have you guys ever seen like somebody with liposuction and then like they after the surgery they just think they can like eat, like not work out, all exactly the same, and you're like, girl,
yeah, that's the thing.
you shouldn't have paid for that.
You have to do it. And if you get surgery or not, that's your lifestyle. You have to eat healthy.
Yes.
You should exercise. These are things that you should do regardless whether you choose to get it or not. I do feel like in society today, though, people, whether they have the money or not, would rather go get surgery if they can.
My issue is really the side effects of like Ozempic and all of those things. And if you're going to do Ozempic and choose the natural things with it, then you might as well just do the natural thing first. That's my opinion.
Yeah,
where
but
it's like,
it depends though, because if they're doing it for their health reasons and they
Exactly.
can't lose weight any other way than doing the Ozempic, they have to do that. But I agree with Pete as well that after and you that once they finish with the Ozempic and they lose the weight, they have to change their eating habits, because if not, they get it all back.
Otherwise, everything's in vain. All that effort that you put in time and energy, it's in vain. And then you're right back at the drawing board again.
Yeah, I also feel like when it comes to stuff like Ozempic, not everybody's knowledgeable. And if you go to endocrinologists, if you have hormonal issues, they're going to want to give you Ozempic or metformin. And you're not going to know. Some people don't know. They either don't do the research or they do the research and they don't understand it. And they end up taking those things and it can go positive and it could go negative. It depends on your body. I've taken Ozempic before, but not because I wanted to. I didn't have a goal. I just took it because my doctor said you need to balance your hormones out. And I was doing it natural, and seeing a holistic doctor costs a lot of money, people, and then they want to switch your regimen every few months. That's just how it is. So, you know, I did try that before it was even popular. Now it's popular, but I understand both sides because I ended up having to get surgery from being sick from Ozempic, and I wasn't even on it that long. But the thing is that sometimes not even just women, I feel like men and women, they won't always know what to do. And when you're exploring your options, you're willing to try because you have a goal and you know you want to be healthy, and it just boils down to so many different things.
I think that working out is a hard thing to do. I am pretty dedicated to my workout, and I think that it takes a lot of discipline and consistency. So I think that a lot of people don't apply that. Working out physically works for me, but some people don't have that and probably cannot start that right away because of their physical condition, right?
Limitations too. Some people have limitations,
correct.
Injuries, or current medical conditions that are kind of preventing them from doing that.
Right.
And when some of them are on medication, sometimes it's causing bad reactions. It's causing them to like be having trouble losing weight, and it's affecting their energy level. So if your mind and body are not on the same page, like your heart, your mind, and your body should be on the same page whenever you're doing some kind of a program. I deal with this firsthand because a lot of my clients are like, they're overweight, they're older, they may have like gout or other inflammatory type conditions. So as a nutritionist, I try to make recommendations for supplementation, like stuff like turmeric. Now, of course, everybody is different in how they're going to react to things because, you know, men and women are different. We're genetically made up differently as well. So what may work really good for somebody may not work as well for somebody else. But it definitely is a lot of hard work. It's a lot of dedication and discipline. And you just got to try to, like, as Rocky would say, keep punching. Get knocked down, get back up again. Keep on punching. Never give up and never give in.
For sure. All great points. I think a lot of us are kind of talking about, you know, our kind of physique and maybe losing certain weight or, you know, kind of enhancing certain things. But there are certain things that I think, you know, certain appearances, certain aesthetics that you cannot really sort of earn, right? Like people are just born sometimes in a way that they're just not happy in their bodies, and they look to plastic surgery to sometimes enhance something that it's not like just about working out more, whether it's like a breast augmentation or they don't like the hump on their nose, and there's nothing else you can do to kind of earn it other than maybe feeling more comfortable in your shoes. But that, I think, is one of these other comments that we're going to talk about. But so that's just one other thing I wanted to add, because certain things like you can only achieve with plastic surgery. Plastic surgery is self-expression, not insecurity.
Man, you put your hand. Bring it around.
And we know these statements are nuanced, so you don't have to fully agree or disagree, but it's just whichever way you primarily lean.
When you go into the realm of plastic surgery, a lot of the times, it is like a Band-Aid on the bigger issue, which in my opinion is a lot of insecurity. I work in a strip club. And so a lot of the women I will see, especially like younger girls that come in completely natural. Do you know what I mean? And a lot of these times, these girls are 18 years old. These girls are 19 years old. They are not what they are going to completely look like. You know, women go through this second puberty at like, 24, 25, especially when your looks are up for debate, sort of in like a money, it puts it in this really weird, like microscopic environment. If some girls notice that girls with plastic surgery are maybe making more tips than girls without plastic surgery, then sometimes these girls, these 18, 19-year-old girls feel like, I have to do that to feel worthy. I have to do that to make money. I have to do that to reach some sort of beauty standard that they think is the beauty standard, when it's not. They go off of, I think that I'll look good with that because that girl has that, and that girl's, is seen as like this beautiful girl or something. So they go try to copy and paste that onto themselves. And then it's not self-expression. It's stemming from an insecurity.
I want to double down on what you're saying, and I think that it has a lot to do with seeing someone else and deciding what the standard of beauty is based on what somebody else's life is giving, right? And then there is no guarantee on what it's going to look like on you. And there's no guarantee that if I say I want an hourglass figure, that is going to look exactly the way that I imagine it in my wildest dreams, the way I see my body. And so the reason why I think it's more of an insecurity than self-expression is because it takes a lot of courage to look yourself in the mirror and just choose to love the things that you really don't like. Like, my behind is not as round as I would like it to be. I would like it to be rounder than it is, so I go to the gym. And there are things, like you said, the gym is not going to fix everything. Your body is just your body sometimes, right? and my behind will still probably be square, but there's some rounding coming on in there because I'm working on it. But I choose to look at it every day and say, you know what, this is how God made me. This is what I am supposed to look like. I don't want to be a copy of anybody else in the room because you look like you, because that's how you're supposed to look.
It's a unique design.
Right, and that's creativity, like you said. That's expressing yourself because that's who you genuinely are. I know
we're all genetically different. We're born with genetically different bodies and you know, how we react to certain things too. As far as the foods we eat or other things too.
And if plastic surgery isn't for you, but you still want to feel and look good, you feel confident. Skin and Hair Care Line by Dr. Gary.
Right.
Well, I think a bit more expansive about plastic surgery. People have this perception of the future me that they want. And so to that end, it is self-expression. But I also buy into the point that there are insecurities, there is body dysmorphia, and professionals should be encouraging clients to take a look at their potential body dysmorphia issues before engaging with physical alterations.
And that leads to mental health. It's deeper than just insecurity. Sometimes it's mental health issues.
Right.
Body dysmorphia is a mental health thing, where it's like you see yourself differently than you actually look. So now imagine if I change everything about myself because I don't even see myself properly.
Yeah,
You
and then
know?
going back to the Ozempic argument, like it's the same thing as like people on Ozempic that are like already very thin, and then they're going on Ozempic and they're looking sick.
Yes.
Like, do you know what I mean?
Yeah.
I know a few.
Yeah, and so then it's like, okay, how do we say like, okay, Ozempic is like good and healthy for like these people to use it for this reason, but then like these people can't have access to it. Do you know what I mean? It's like
Like the abuse of it.
yeah, abuse of it. The most beautiful woman in the world to you is gonna have insecurities. Do you know what I mean? The most beautiful man in the world is going to look, because they have to see themselves every day.
Something that I sometimes think about is even like makeup or like less invasive things that people do for their aesthetic, you know, kind of enjoyment. I think can also be seen as potentially sometimes a sign of insecurity. You know, some people, you know, like to be more barefaced when they go out to places, and other people like to kind of look a certain way, and that's fine, and use more makeup. The way I see it, and I've thought about this, you know, as I've filmed lots of videos and then see lots of patients, but I see it as like a spectrum. You have like the fully non-invasive stuff, you know, which is like essentially makeup and, you know, some eyelashes, whatever, grooming type things that, you know, men and women do. And then you have like the less invasive cosmetic procedures. Oh, you have like skincare, you have hair care, you have stuff like that. But then you have like, you know, laser treatments, you have Botox, filler, you have these non-surgical things, but I really do see it as like one big continuum. And then on the extreme end, you have plastic surgery, which has more risk, but, you know, it has much stronger potential to make a change that other things cannot, you know, cannot possibly, you know, kind of compete with what it can do. But it's like a powerful tool. But I think all of us, as my thinking on it, are insecure at some point in our lives, and in some situations. I don't think we're ever all secure all the time. And we do these different things to try to, you know, make ourselves feel better, to try to have other people think about us in a certain way, a certain more positive light, perhaps. So I don't know what you guys think about that. But in terms of the spectrum, where you have makeup and then you have plastic surgery,
Yeah.
but are they all just kind of trying to accomplish the same thing in their own way?
That's how I do agree with that.
Yeah.
It's what the person really chooses for themselves. And in regards to like insecurities, I feel like you can have surgery and be insecure. You cannot have surgery and be insecure. Like you said, some women wear makeup, some women don't. It boils down to the individual. If you're insecure, you're insecure. If you're confident, you're confident. Some people just use surgery to feel, if you're doing it to be the best version of you, go ahead. If you're gonna do something, do it for you to feel good, but don't get obsessed with it and pick, and then it's like there's some people that do and some people that don't, and then there's some people that look at celebrities and social media and what's in your feed and what women look like or are expected to look like and become obsessed with it, and that's where it becomes a problem.
I think what you said was really good about how sometimes it starts as one, and then my problem is that there's this continuous picking yourself apart. You got your nose done, now your eyes need to match your nose. Now your cheeks need to match your eyes. Now your breast needs to match your eyes. Like, okay, we get it. And if that's the case, we all can stand in front of a mirror and pick ourselves apart for every little thing. Who are we trying to be perfect for? I think that's a part of my problem too, because if we all have insecurities and we all go through the same thing, why do I need to look or be what somebody that is successful needs to do and to get to where they are? You know, we all are the same. We all have insecurities. So maybe I should just rock being me, however I do that, because it's always going to be different than the way that you rock being you, especially when you're genuinely you. And it's always going to be different than the way that you rock being you. So I think that's the beauty in it of, you know what, this is how I was made, and that's just it.
I definitely grew up with like low self-esteem, so I think I always judge my body always. And I have psoriasis, so that made it worse. It's gotten better because I have to take Ozempic, but that has bettered my psoriasis, but I still have scars. So what can I do about that? Maybe I could get surgery, but I don't have the money for it. Would I? Maybe, if I had the money. I think it's about the insecurities within myself to make myself feel better. But then at the same time, I'm like, but what if I change that? Would I feel better then? Or am I going to regret it if I do it and it doesn't come out right, or whatever the sense? I might just pick at that also. So I think that for me, sometimes I have to self-talk myself and tell myself that I'm beautiful the way I am. And so I kind of struggle with that. Yeah, so I work on it.
Yes, and I like what you said, because I do the same thing where it's like, even if you don't believe it, sometimes I do look at myself and I don't like this or I don't like that, but I'm going to force myself to believe it, because if I don't believe it, nobody else is going to believe it. And if I'm not proud of who I am genuinely, how can I walk into a room with confidence and really want to own the place if I'm not even really myself right now? I'm just trying to be what everybody in the room thinks I should be.
And I think everybody's so much into themselves that they wouldn't even notice you, even if
That's
that.
and you do all of that work, you don't even care.
Nobody cares.
Love yourself. At every stage, you have to love yourself, you know? And I do understand where everyone has their own insecurities. So it does present a challenge, especially for people that gotta go out and be in the spotlight. If you like an entertainer and people are always looking at you, it's like you gotta know yourself. You gotta love yourself. Yeah.
Just writing comments on
Because I feel like you can become obsessive and addictive to other things. Surgery is one of them, but people do it with drugs and alcohol, and there's so many other things. People might channel their energy in a more healthier way, exercise. But it's like, you know, it's either or.
You can love yourself and still want plastic surgery. Anyone who's pro that saying it's pro general plastic surgery. That's the point.
I love myself, and I would still, in my dreams, want a plastic surgery booty and stomach. I wouldn't do it, but that doesn't mean that I wouldn't want it at the same time. It's not like, oh my God, I would never. I hate it. It's like, I do love myself. I do go to the gym. I'm not going to get a surgery, but in my ideal world, if I could just wake up with the hourglass big booty that I would love, that would have been great.
I would love surgery for many things, like my eyes, and just like, because I'm starting to sag because of my age. And
No, you're not.
But I think, I don't know what I really like it after I get it done. So there's like a yes and no kind of feeling, and
Okay, so I'm on the island over here. Okay. All right, well, because of the way I grew up and because of my old school mentality, I mean, I would probably resort to plastic surgery only if I probably had to, like in an emergency situation. For example, if I suffered some kind of trauma and I suffered burns on my face, or I suffered disfigurement to my nose and stuff of that nature where I would have no choice to do it, I would always explore every natural alternative first. If I really felt like the need that I absolutely had to get it, then obviously I would do it. But in general, I would try to do everything I can to probably not to avoid doing it, because that's just the way I grew up, and that's just my mentality on it, because I've always preferred the natural things to it. But if I really had to do it, I would obviously do it.
So, you love your mom, right? Most people love their mom. I think some people don't, but that's not my issue. You can love your mom, like unconditionally love your mom, but there's probably some things about her that might bug you sometimes. You're not going to change them because that's your mom and you love her. But if somebody came to you and they were like, oh, you know, like your mom will stop like saying, hey, Madeline, and then like starting to tell you a story, and then like completely stopping and then like walking away and like not finishing the story. You're like, I really wish she would like not do that sometimes, but I still love her. I love her unconditionally. Do you know what I mean?
That was good.
So it's the same thing for me. Like, okay, I really wish, you know, sometimes, you know, I had a little bit of cleavage to show off, you know. I wish maybe sometimes that I had like, you know, a little bit of, you know, this, that, whatever, but that doesn't mean I don't love myself.
Right.
You know?
I can tell you from my perspective on the professional side, when people come to me and they're baseline happy people and they're positive and, you know, they have very similar kind of attitude to life as you do, but something bothers them, something that maybe, you know, for example, their hair is thinning or, you know, something is sagging and it's kind of changing and it's bugging them and they want to adjust that when we do things properly, safely and with proper technique and, you know, really understanding what the patient wants and we achieve results that, you know, as predicted, they're still very happy people and they're just a little bit happier, right? But when people come in and they're just down and they're just, everything's gloomy and their affect is off and all this stuff. And if we operate on someone like that, it's almost, I've never really seen it for them to all of a sudden, even if the result was perfect and it looks great and everyone would say, wow, you look great. And a lot of those people, they still look great even before the surgery, but just something is eating away at them and they're kind of miserable and they stay miserable. You don't make them happy all of a sudden just because you tweak something and made it maybe prettier. So I think a lot of it does stem from just kind of general, you know, attitude and personality. And the surgery usually doesn't change them too much. People should not be getting as much plastic surgery as they are.
I agree. I know some people that just take it too far. I was just watching a show on Zeus Network that was like the baddies or something like that, and it's a young lady that was on there and she was saying how she had 20 surgeries over her whole life and how she's been in 20 mental institutions as well. So it's just like, I think some people are taking it too far, getting way much more than they actually need. Even when I look at Cardi B sometimes, I'm just like, bring it back. At some point, when do you just stop? Do you just want to become a whole new person at this point? And then that makes me feel offended for who you actually are, because now you're saying who I really am and who I was born as is not enough, and whoever this made up character is that I want to be is better than me. I don't like it.
I agree.
I agree. I think, so how many celebrities do you see nowadays that were preaching body positivity, we're preaching uniqueness? I don't want to name celebrity names. And then, but there's multiple, there's been multiple, and over history, it's a thing, you know, they're like, either I love my body, or, you know, I love my nose, or I love my face, or I'm never going to get plastic surgery. And then all of this kind of like pressure and stuff, I guess, from like Hollywood or whatever, and then people are getting plastic surgery when they like don't need it, or they're changing their literal like root morals that they had to get it.
You know, there's people that are broke because of it, probably on debt, because they can't afford it, but they want it because they're addicted. And it's like always constant, because if something changes, then, I mean, as you age, something else is going to change. So you want to fix that. And it's like there has to be a borderline. I think they cross that thin line. So it's like, it becomes an addiction, I believe, and people start looking the same, or not. They look, I don't know, they
It's
look
an
like,
unhealthy addiction.
oh my God, they just look
It eats
so
away all your money.
fake. They just look so fake, and I think that's going overboard.
I don't have the data in front of me, but I would imagine that the percentage of people that have had plastic surgery or some kind of cosmetic surgery has probably spiked, and of course it's because of social media. Nobody sitting here is the creator of the culture that is obsessed with superficiality and vanity and things like that, but we all do live in that culture.
Yes.
In a way, and I'm not saying it's a good thing or a bad thing, but in a way, we all kind of have to adjust to that. That we're all so connected to each other now digitally, and we all have to present ourselves because we're all kind of marketing ourselves as brands versus people.
It's sad that a lot of younger girls, I don't know about the boys, but the girls are doing these surgeries, trying to improve themselves at such a young age when they still have so many years to grow, and their facial features are going to be changing constantly as they get older, and they're just going to continue with the surgeries. Once they start, I don't think they're going to stop.
In a way, it's kind of a bad message for kids because, you know, if you grew up in a house, say, where your father had no hair or your mother had a certain chin in a certain shape, people used to have pride in those sorts of things, and now we're changing it.
Yeah.
We're you know, kind of running away from our own gene.
Thinking about all of these kind of outlier cases, these people who have multiple procedures done, you know, the guys who want to look like a Barbie doll, those are really outliers. I don't think of them as people when we're talking about a more general sense, that people are, you have your different needs. We have some that are maybe premature, like girls going out and having certain procedures done. But as a whole, I think people are getting done what's necessary to fix deformities and a few things to feel good about themselves. But I don't feel it's, as a whole, excessive.
I think that there's an over-representation in the media.
Perhaps,
And the media is what a lot of people are consuming. And I think there's an over-representation in influencers, in celebrities and things like that. It's very public, like you kind of see them go through this transformation over time. And so since there's an over-representation in the media, it doesn't even necessarily just need to be like an overrepresentation of plastic surgery in normal people, because that's what normal people are consuming. And that's what is going to start to go into normal people's heads as, I should look like that because that's the only people I see on TV are looking like that. Do you know what I mean? And then it puts society further down this narrative that we all have to be one kind of attractive. When in reality, working in you know, clubs or whatever, you can see that people prefer every different kind of beauty. Do you know what I mean? There is some kind of beauty for everybody. And I think like Hollywood going down one lane in beauty, which is, you know, super enhanced or just, you know, completely changing their features, whatever. I think it could be, it's an overrepresentation.
And I want to build on that because even with social media, right? To us, the celebrities that get the surgery, you could think they look perfect. Some of them still be editing their photos. So it's all like, you don't know what is what. And then I feel like the obsession part where people become obsessed with surgery, a lot of the times they think if I do this one thing, I'll be exactly where I want to be. They don't realize some girls get 2, 3, 4 rounds of BBLs and come back might get lipo, and they you know, that's the reality of it. You might get one, they say like, well, the first one's the base, the second one's projection. It's like levels to it, but it's true. And I feel like these people, they might look at somebody and be like, wow, because you know, we are in the age of social media, and like what you said, it's so congested, like you see the same thing over and over, so it's like, I don't know, it's just like an illusion. But then you might see somebody in person and be like, oh, okay. So
And you might see the same girl on social media in her BBL in person, you're like,
Ew. Yeah.
that is not what it looks like on your page.
I feel like it's like that with fillers too. Like especially when you see somebody that has filler in person, like a lot of the times it'll make their features look more big in person. But in a photo is just like a little bit of illusion. So it might look one way in a photo versus in person.
As we enter the world of AI, you know, and all these fake bots,
It's even worse.
you don't even know what's real. It's impossible to tell. You know, everyone's just living these digital lives. I can tell you when I do my intake and I get like the patient's medical history, surgical history, I prefer that there are only a few surgeries, if any, mentioned, you know, so if they give me a laundry list of surgeries they had in the past, unless they're sort of justified and it kind of makes sense, like if they're older, they had, say, a facelift and with that came the brows, like if it all kind of makes sense, fine, but they're a younger patient and they're giving me a laundry list of surgeries, to me that's a massive red flag. To the point where I might not offer.
Responsible, right? I don't know, doctors care, and some doctors like, you cut the check, I'll do it. So it's just,
That's really responsible of you.
Dr. Gary has integrity, and you know what else has integrity? His skin and hair care line. By Dr. Gary.
All right, next question. Plastic surgery patients should seek mental health counseling before undergoing a procedure.
Absolutely.
I agree
Yes.
with that.
Yes,
Absolutely.
it's pro.
Does anyone
It doesn't have to be long term, but I think just like an evaluation at least.
all
Yes.
patients?
Definitely have an
yes.
evaluation, without a doubt. I think that's definitely the way to go, and I agree with that.
Even if it's like a 5-10 minute evaluation by a psychiatric professional or something, I think. Yeah.
Because sometimes people think they're going to the surgery table to fix all of their problems when it's really the therapist that needs to fix the problems. And then what if you went to therapy and realized I don't even really want surgery? So I agree. Mental health assessment first.
Absolutely, it's the ethical thing to do to rule out those issues. Like you were saying, you do the intake and they've got this laundry list of surgeries. Those people, you start screening them, they're probably going to show up a larger number of folks that have genuine body dysmorphia.
I do agree. I know though that a lot of people won't, so I do feel like the medical practices should, like they're gonna ask you questions, but I do feel like I said, you won't take everybody. So I feel like as a professional, when somebody's like, I want to take it this way, or I want to just give you a rap sheet of everything I want. So I do feel like, it's important, and especially for the doctor,
That's what I was thinking. It's kind of what you were describing. That's kind of like your mental health exam. It's a similar process,
I don't necessarily agree. I don't think every person that's trying to get some sort of modification is doing it because of it's some sort of byproduct of trauma. I think some people just want to look better, and they may be of completely sound mind, and they may feel great about themselves, but they may be elevating how they feel, even greater already than they already were. There's a distinction between, say, something like a hair transplant and somebody who's getting some sort of body modification of some sort. I don't know if I would have needed to get therapy or some sort of an appointment with a mental health counselor because I wanted to frame my face better or have more hair on my head.
Well, hair is a little different because you can go get a haircut. Do you know what I mean?
What if you don't have any?
Yeah.
What if you don't have anything to cut?
A wig.
You shave it.
Yeah. Okay.
See, but that's crazy.
I agree with the doctor and with the statements, and I think that at some level the doctors should be responsible for evaluating the patients and seeing whether maybe they should need to be seen by another psychologist or whatever before the surgeries happen, or especially if they're receiving multiple surgeries.
But just imagine the scenario of like someone wants a hair transplant, they're insecure. They go to the hair transplant surgeon. Surgeon says, oh, go see the psychiatrist. What are they going to do other than talking to them about the insecurity, where it's stemming from? But let's say they don't really get anywhere. They talk to them, they don't really get to any resolution, no better place. The person still doesn't feel good about how their look is changing. And then it's like, well, what do you do next? Do you put them on a medication? Is that any more risky, potentially long-term medication compared to a hair transplant surgery if it goes well? So I think we got to think about the risks and benefits of medications versus surgery when it comes to mental health, if it even gets to.
I don't have an issue. I think hair transplant surgery is great. I was just saying, I think that there is a way to be confident and to look good, bald or with hair. I think hair transplant surgery, it's non-invasive and it's not necessarily changing something about you completely. I'm sorry, but you had disclosed that with your hair transplant surgery, it's your own hair.
Yeah.
Do you know what I mean? It's not fake hair. You're not switching to curly hair. Do you know what I mean?
But it wasn't here. It was here. They had to move it. That's a
change your hair.
Well, that's a huge.
It's gonna change the way you look, but
It's a
not
huge
really
change.
gonna change your appearance. That's gonna go so bad that you're gonna not recognize yourself or something like that. Where other surgeries
Well, it could.
would.
It could.
I could if it's improperly designed.
Yeah.
There are real risks to it.
And for people with kids, what about the fact that if you're the dad, then your son still might get the bald gene too, and now he's so used you change it. So now he's going to feel insecure about it too, instead of seeing my dad rock the ball.
Well, because they
And we just bullheaded in this family.
sometimes too.
There is no perfect answer. Unfortunately.
Figuring it out.
Yeah.
This answer has like a lot of gray area to it.
One anecdote from my fellowship training, one of my mentors there told me a story. He used to send all of his patients for psychiatric evaluation before operating on them, especially for rhinoplasty. But then what he found was that the psychiatrist would assume that he was trying to get the okay from them, that he wanted the check mark okay to operate. So they'd send him back saying like, yeah, this person's fine. But he was actually trying to get them to say no, to some of these patients, but they were coming back. So that's another like interesting thing just between the specialties, that I think in one session, a person can sort of put on a show that they seem okay. They seem like they have a good reason for wanting a modification. And then the psychiatrist says, good to go. And then it's almost harder to say no as the surgeon, because then you have site clearance. I'd rather screen them myself. And then there are very few times when I'll actually tell patients, like, you really need to see, a mental health specialist. And partly because I'd rather deny them in other ways, and, because they've paid me for a consultation. Here I am telling them essentially that maybe they're crazy, or it can be interpreted that way. They can get quite upset. So I'd rather frame it like, maybe my aesthetic doesn't align with your aesthetic, or I'm just concerned that maybe I'm not the right fit for you. So if I say no to someone, it's usually in that way, or I'll give them a few more obstacles, like, I can't make a decision off this video call. You have to come in. They come in. I say, I'm still not sure. I have to think about it. They're like, what do you mean? I want to sign up. And I'm like, I know, but I need more time to think about your case. You put these roadblocks there. They have to really want it. Or I tell them, come back in 6 months and we'll talk about it again. They're like, what do you mean? I wanted the surgery yesterday. Yeah. So like that, but for me to actually say that, look, there's enough here where you really need to like seek mental health, that takes a lot. But I will say it if I actually think it's in that person's best interest to do that.
I love that too. Cause for me, like I would never get plastic surgery because I can't order something online without like 2 weeks later it comes in, I don't want it anymore. You know what I mean?
It changes.
So the 6 months like thing, that's really good.
Yeah, just time. Sometimes you just need time. People need to think about it. Sometimes you just need time on the order of years. And sometimes it's just, a few months, and you want to see if the person has the same, pattern of thought,
Grace period for evaluation, a time to really think it over hard and then weigh the options. Maybe I should hold off and not do this. Maybe he was trying to save me from myself.
When I say that, I always tell patients, look, someone's going to say yes. You should be thankful that I'm saying no, and really think about, the reasoning, especially if I'm telling them, point blank what the reason is. Think about that, because someone's going to say yes, and then you might regret that.
And maybe some people who maybe they have mental health issues, maybe in some cases, maybe having that done, whatever it may be, that procedure, maybe that galvanizes them to seek further treatment, and maybe they could really improve themselves mentally even after they've fixed, the physical side of it.
I do feel like both the person that wants surgery and the doctor should kind of be accountable, but more so really the person that wants to get it. I don't feel like it should be something that's like, oh, I want to get this right now. Like people that really do surgery, like girls, they will look into it. They have groups now, everything you can go and see, the hashtags, and you talk to other people that was with that doctor. Make sure that you're going to be safe. Who's going to be around you? What kind of medications do you have to take? What do you have to do in preparation to prepare your body before and after? You have to do those things. So I feel like that whole research process shouldn't be done right away. It's gonna take a few months. If you want to be safe and make sure that you're good and not have anything go on, then you definitely should be preparing yourself.
And if it's something that you can't wait on, then maybe you shouldn't get it.
That's true, because anything worth having is worth waiting for.
Yeah. If it's something you can't wait, if it's something that you need right now, you shouldn't.
Yeah, better to be safe,
Well, it's avoiding that buyer's remorse. And I've had friends who've had procedures, who've had nose jobs, eyelid jobs, who've really regretted that There just was something not right about the results. It didn't match up to their expectations. The patients need to have those clear expectations and be able to articulate them back to the professionals.
I think it's important for people who have had surgeries and regretted them to speak out about it so that people do have an understanding that it's not all glitz and glamour the whole way through all the time. You don't always feel 100% about it for the rest of your life. There are a lot of the girls in the industry that have had like butt shots, and now some of them are coming out and saying like, this is starting to destroy my body. I almost died because it broke off into their bloodstream. So now they're telling people like, don't get the butt shots. I regret doing it. And I think it's just as important that if you have a success story and it worked out great for you, great. But there are people that need to know that you might not feel the same way.
Right.
It might not work out the way that you wanted to.
That's why the research is important.
Right.
Not going to the doctor's Instagram only, because people post what they want you to see, but there's things that they might not want you to see. So if you do choose to do that, go to forums, go talk to people. There's like-minded communities, girls that are thinking about the same thing, you know? People that have went and have good experiences, and some have bad, and then there's sometimes you have a good marketing team. You might think this doctor's amazing, and then they got a great deal, and you want to go there, but you don't realize what's hidden. People don't want to be under scrutiny, because if you're getting something done and you feel good about it, and then it happens, and then you get botched or something, and you post, it takes a lot for somebody to be open and vulnerable. So sometimes people do, and they're like, oh, shouldn't have did this in the first place. People don't want to hear that. It's just to help another person. So in order for somebody to help another person, people go through different experiences. So I do feel like, you know, there's women that do share and there's men that do share, but you have to dig for it, you know? You have to dig.
Also finding people that are honest about the recovery process.
Yeah, too.
Because like I've seen some videos where women are honest about the recovery process, specifically about more invasive surgeries, but it's like, wow, like that's like you have drains coming out of you.
Yes.
Do you know what I mean? You can't sit down. You're in pain for like weeks. Do you know what I mean? Like it's not like some people like don't realize like this is a major surgery.
Right, and it's not just paying for the surgery. You gotta have aftercare, so in case something, you have to have a plan. It's not just one thing. Some people just get hypo for the one thing. Oh, this person got a deal, let me put my deposit down. No, because you gotta have money in case. You should be smart about it. Don't just do things just because you want to get it in real quick. No.
Yeah, being too impulsive work against you in this case, you know, definitely for sure.
And we feel differently every day, like all day long. Some days I'm feeling a certain kind of way about myself in a positive way, and the next day I might not be feeling that way. So it's like,
so you have to make sure that every single version of you wants that change.
Exactly.
If there is a version of you that doesn't want that change, do not try.
If you're not 100% on it, then if there's any kind of doubt, then you don't do it.
Thank you all so much for joining me today. I think one thing we can all agree on is that these topics, these different statements, are very nuanced, and you know, I think we can all agree on some aspects of them, disagree on others, and it's a very important topic in our society today, and not just like in the US, but internationally. You know, people are traveling to all different places for surgeries. It's important to talk about all these different issues that are related to plastic surgery. And the good and the bad and the ugly. So thank you all. Yeah.